From KETK, you're watching East Texas Live.
Hey, welcome back. Joining us now is Megan Riaz from the Bethesda Health Clinic. And you're here with some pretty good news for you guys. You're expanding, I hear.
We are. We're super excited about it.
So expansion, I'm guessing, is in your Tyler location?
So we're actually expanding with the services that we're offering for the community. For the past 20 years, we have focused on adult health care. We've done medical and dental for the working adults of our community. And the reason why is because there's an organization called St. Paul, and they always provided pediatric services. Well, as of Friday, we have actually partnered with St. Paul to offer Bethesda Pediatrics. So now we're going to be offering services for the whole family.
So who qualifies for this? You know, usually when you hear about low-income people or the lower class needing health care, you think Medicaid, but this isn't the same.
This is a little bit different. So for the adults that come to Bethesda Clinic, they actually don't have any insurance, so they can't get on Medicaid, but they don't make enough money to afford private health insurance, and so they would otherwise fall through the gap. With the addition of Bethesda Pediatrics, those are actually for the kids who are on Medicaid and CHIP, and then also the kids who may not have health insurance, but their families can't afford to pay, you know, the full cash pay price, so they can come to Bethesda Pediatrics, and we have a sliding scale there, just like we do for the adults at Bethesda Health Clinic. And then obviously, because we're going to be helping children, we won't turn any child away regardless of their ability to pay.
So how can people get involved if they think they may be one of these people that's fallen through the cracks and they're looking at maybe getting some help with their health care?
Yeah, so they can visit our website. We have all the information on there. To become a patient, an adult patient at Bethesda Clinic, there is a small admissions process. Just have to show your income and a check stub. For Bethesda Pediatrics, they can actually call the number and they can just make an appointment, and they can help them everything there if they're uninsured.
Yeah, you know, we have, like I said, Medicaid for the poorest among us. We have Medicare for the oldest among us. And then for so many of us who have, you know, health care through our employer, we forget about so many of these people that are, say, self-employed or just getting started or just at the...
Self-employed people that, I mean, a lot of our patients work at daycares, or they might work for the school system, but they work in the cafeteria, or they drive the school bus, or they, you know, self-employed or lawn care or anything like that, and they just really don't have a place to go. And we don't want anyone to use the emergency room for primary care, so we want them to be able to live an abundant life, and they really can't do that unless they're taking care of their health. And then with children, it's easier for a child to get on Medicaid than an adult. So we typically see it's the same families that we're serving. We're just now going to be serving them all together, and we're just really excited about this change.
Well, thank you, Megan, and it's good to hear you're expanding. Sounds like you're doing a lot of good work. If you want more info on maybe how you can help out or be a part or get some health care, more importantly, go to BethesdaClinic.org. Megan will be there probably. Coming up next.